Good afternoon and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist. I'm also adjunct faculty at the University of New England, Australia, School of Health, where I received my full training about human sexuality and I did my publications. I'm here today with Dr. Robert Jaffe, who's going to be joining us momentarily. And we offer this program to you so that we can help you to gain some answers to some of your questions that you may have about addictions, trauma, codependency, and how they overall impact, relationship. So the topic for today is PTSD, which is basically short for post-traumatic stress disorder. And I'll let Dr. Jaffe himself to go through those details for you and explain to you what they are. Meanwhile, I'm going to introduce our phone number, 951-922-3532. That's 951-922-3532. And I'd like to hear from you, because we know that, your experience is the most important point here, because based on your experience, we can provide you with the answers that you may wish to have so you can benefit from this program. This program is new. This is our third week. Starting in the afternoon. We used to be airing this program on Friday mornings at 9 a.m. So we're glad that, we can be having you, and some of you are new to our program. So welcome, and welcome, Dr. Robert Jaffe.
Thank you. So today we're going to be talking a little bit about PTSD.
I didn't introduce you properly about your titles and everything.
My titles?
Yes.
Oh, okay. All right.
So, my apology for that.
That's okay. I'm Dr. Robert Jaffe. I'm a licensed marriage and family therapist. I've been in full-time private practice since 1984, and I'm also a certified hypnotherapist, and I specialize in the treatment of trauma and post-traumatic stress disorder and addictions, as well as concurrent depression and anxiety. That's what I do, and I have a great passion for it.
You certainly do. I mean, I have been working very closely, with you on a daily basis for the past, well, guess what? I know you're not comfortable with that, but I'm going to say it anyway. You don't have to listen to it.
Okay.
The number is 17 years.
Oh, my goodness. Every time I ask you, it seems like a year. We've gone another year.
Well, pick a number. We will keep it at that. You want it to be 10 years?
All right.
Want it to be 5 years?
No.
We just met. I just met Dr. Robert Jaffe across the hall, and I invited him in to join us because, specializing, and he's a great guy to begin with.
Oh, thank you.
And he's a wonderful, amazing, knowledgeable, experienced clinician in the area of trauma.
Okay.
So nice meeting you, Dr.
Nice
Jaffe.
meeting you too. So, and the reason that I am so interested in it is, like a lot of people, it's personal. I came from a family that had a lot of love, but also a lot of pain. And it ended up with both my sister and myself suffering from addictions. And so when I went back to school and I decided I wanted to become a therapist, which actually happened as a result of my getting my own therapy. And in my own therapy, I went into therapy not really knowing what I wanted to do with my life. I was in business at the time, but feeling like that wasn't a passion of mine. And while I was in therapy, I really recognized that, this is something that I really feel strongly about, and I'd love to do it. So I went back to school at age 30, and here I am now at age 71, still going strong, trying to keep my body strong. And so this is my passion, and this is what we're going to be talking about over the next hour. And we want to invite you to call in. Our phone number is 951-922-3532. And what is that, 17? Oh, 17 years she's showing me.
I did
Okay,
the math.
okay, 17 years. We've been together, and it's been wonderful. We have a wonderful partnership, a wonderful friendship, and a wonderful collaboration. We're in the process of doing a number of things together. We're getting close to publishing our first book. The book is called Not Tonight, Honey, I Have a Headache. And it's all about, guess what? It's about sexuality, and there's some trauma in there. And so that's what we do. And today we're going to talk about PTSD, which is post-traumatic stress disorder. What does that mean? Well, post means afterward, right? Traumatic means something that was traumatic. I'll tell you a little what that means in a second, but it's after the trauma. Stress, we all understand what stress is. It's something that doesn't feel good in our bodies and often occupies our time trying to release it and get rid of it. And disorder, well, that speaks for itself. So what does it mean to have post-traumatic stress? Well, there's actually, you can talk about the actual disorder, which we have a book called the DSM, which is the Manual for Mental Disorders. And if you want to look at that, there's specific things that they say in the DSM that constitutes actual post-traumatic stress disorder. But today in our program, I'm going to be talking about it a little more generally and a little more loosely, because many people have symptoms of post-traumatic stress, but they don't qualify for actually having the disorder.
Right.
But it doesn't really matter, because if you have a symptom and something is bothering you, it's important to you. So you don't have to have, they have like 5 or 6 different symptoms and syndromes in the DSM that say you have to qualify in order to qualify for the disorder. But we're not really concerned about that right now. What we're talking about right now is when you have something in your life that's bothering you, and it can affect you both physically and psychologically, that it can come from post-traumatic stress. You don't have to actually have the quote disorder, right?
Right.
So so I said a moment ago, post-traumatic, and then I said traumatic is trauma. So what is trauma? And trauma is actually an individual thing. There are things which we consider basic traumas, such as earthquakes, cyclones, hurricanes, that do devastation to cities and to people, and that's of course traumatic.
And also that includes sexual assault.
And of course, then there's of course the trauma that occurs between people, which includes sexual assault, right. Includes physical assault, right. Includes robbery, things which we also understand. I think the majority of us understand to be traumatic.
And these traumas are the type of traumas that they do not occur all the time.
Right.
Right. Like, I mean, we have had, since I've been living in Los Angeles, I have experienced 2 major earthquakes, mm-hmm. right, which is during the past 45 years, mm-hmm. right? And I hope that was it for me. I don't want to experience another one, right? Okay. I mean, car accident. People don't always get every day involved in a car accident, right? Mm-hmm. So these are on the category of large T traumas.
Correct.
Right.
Correct.
But the main, I would say, the category of trauma that profoundly, impacts people, mm-hmm. right? Without having the knowledge of it, all those that they are pervasively happening across our different lifespan, which we call them small T traumas.
Right. Right. And that's only been recent that people have been able to differentiate.
Right.
uh, because people say, oh, well, that's normal. And a lot of the things that we call small t traumas are normal.
They seem normal. We have accepted them as normal.
Well, normal simply meaning that they are the norm within society.
Yes.
It doesn't mean that they are healthy
Right.
or appropriate, but they are the norm. So what would be an example of a small t trauma? Let's say bullying.
Right.
Bullying might be a small t trauma. Could also be a large t trauma, but it's so pervasive and happens so much in society, both with children and with adults.
Name calling.
Name calling, that can be a small t trauma.
Comparing children with each other, within the family and with the outside world. Competitions.
Any negative comparison.
Right.
So and so the negative comparison can be traumatic, especially when the comparison is as though the person is a bad person because they don't measure up.
Right.
So, gee, you're such a nerd, you look at the clothes you wear. Right. Those are kind of statements that can be small t traumas, right?
Exactly.
The person gets offended, and somebody else is offending them, and if it happens once, it can be damaging. But if it happens much more than once, it can be very, very damaging to people. One of my clients I was talking with earlier today was raised in a family where the father would just burst out shouting obscenities, generally at the mother, but also they could be directed at himself or his brother.
Right.
And it made him very, very scared. And so those can be put in the column of small t traumas. The person gets scared. So any trauma that we experience that isn't able to be what we would call in psychology worked through, which means that you are able to process what happened to you in a way that doesn't affect your sense of self, that doesn't affect your self-esteem. It might temporarily, but it doesn't permanently or for a long period of time affect your sense of self-esteem, your sense of self-worth. Those are traumas, and it can, and we can say it can be either the large T or the small t, that can negatively affect us sometimes for the rest of our lives, until and unless they are addressed.
Right.
And so, but people, because so many of these small t traumas, one of them was, I remember you're telling me where you grow up that you would have, the girls would go out to recess and the boys would have all of this great stuff to play with, and the girls would, they'd have like a hopscotch thing, and and so. And you even at that time said, well, what is this? Why, well, I'm a girl and I'm supposed to play hopscotch, and they get to go out and play tetherball and hit the ball around and play baseball and all of that. Why can't I do that?
Right. Or hot summer, people, boys are able to go out and have fun topless, right? Where girls have to cover themselves.
Right. And that was true even with girls before they went through puberty.
Right. Exactly.
Even before their breasts developed, they would still have to cover themselves.
Has to cover themselves, and then makes you wonder. I'm a human being too, so why my value is less than, and I need to cover myself. What's wrong with my body to begin with that I have to cover myself?
Right. And then, of course, once you ask that question, what's wrong with my body, you're already in the category of thinking that there is something wrong with you.
So that's there you go. You're a human being feeling the same as everybody else on the surface, but then again, you feel less than, and you have to live with that. So that becomes a pervasive trauma.
Right. Exactly. So
traumatic experience, it's pervasive because it's there all the time. The belief is there all the time.
Right. So when we grow up with these traumas, some of which are small t and some of which may be large t traumas, and those things stay locked inside of us because we don't have anybody to talk about it with. We don't know what to do with the emotions. They keep, we live in the now moment. So what we do is after the trauma is past, we don't think about it.
Right.
And we think it goes away, but actually what happens is it gets relegated to our subconscious or unconscious minds.
Exactly.
And once it gets relegated to the subconscious or unconscious, then it stays there until there's a time when it surfaces. And when it surfaces, then oftentimes we're confused. We don't understand what we're feeling or why we're feeling it. And these are old feelings that we've held on to. What we call in psychology repress those feelings until and unless they are triggered. And so the more that we are traumatized, the more triggers we carry within us.
Right.
So, and the triggers can be triggered by anything. They can be triggered by our own thoughts. As we're mulling something over, we can think of something, and that trigger can affect us. And it can be triggered by another person, and it can be triggered by something that we hear on the radio or the television, or read.
Right.
And once those triggers come up, then we become flooded with these old feelings that we've repressed. And the flooding is what we call post-traumatic stress.
Right.
Is we get flooded with it.
Right.
So
and that stays with us. You know, that stays with us, makes us feel very uncomfortable, agitated, stressed out. You know, gives us anxiety. We are unhappy all the time. We are unhappy, you know.
Yeah.
And then people ask themselves, you know, I don't know why I'm so unhappy.
Mm-hmm.
I don't have anything specific to point out to, but I feel unhappy.
Yes.
I feel uncomfortable. You know, I can't feel belong to a group, or even when I'm sitting in the crowd, I don't feel good. I like to be by myself. You know, people come up with variety of different experiences, sharing about their PTSD, and they don't know they have PTSD.
Exactly. So we just got notified that we're going to go on our quick commercial break, and when we come back, we're going to be talking about some examples of PTSD, and then how those and how people can get help with that, which is really what we want to do, right?
But also we want to hear from you. Please call us 951-922-3532.
See you soon.
Addictions, codependency, and their impact on relationship. And then we are talking about PTSD specifically. Please call us 951-922-3532. And also please introduce this program to those that you believe they can benefit from. And we thank you for sharing your hour with us. Dr. Robert.
Yes, ma'am. So we've been talking a little bit about the definition and what trauma is and what PTSD is. And so the most pervasive PTSD, the most pervasive and the most common, comes from our childhood wounding with the family that we grew up in. When I say pervasive, I mean that the statistics are pretty crazy about how many people are wounded as children, emotionally wounded, sometimes physically as well, but usually the physical wounds heal a lot quicker than the emotional wounds, unless, of course, we've been tortured or something like that. But for the most part, the physical wounds, if we were physically abused, and not all of us were, some of us were just emotionally abused, but the physical wounds do heal. The emotional wounds, however, can linger and can cause us a lot of unhappiness and a lot of pain within ourselves, and also especially in our relationships. And why is that? Well, that's because we were brought up by people who were wounded themselves, and for the most part didn't get the healing that they needed.
Right.
So now that's not to say that our parents, if they did wound us, didn't love us. Unfortunately, that is true. Sometimes our parents weren't able to love us. Sometimes they did love us, but they were still wounded, and so their wounding still negatively affected us. And so what we do as children when we come into the world is we recognize that we're helpless. Even though we don't have our intellect developed, we still recognize that we can't do anything for ourselves, right? At the beginning, the only thing we can really do is our bodily functions. We can cry and we can eat and we can pee and we can poop, and pretty much that's about it, for the first few months of our life.
Pretty dependent on our caregiver.
Totally dependent.
Right.
Right. And so, and then that dependency, as human beings, that dependency lasts for quite a while. Even when we get to be 5 years old, 6 years old, 10 years old, for the most part, we can't take care of ourselves. So we are dependent. So what would it be like if you were 4, 5, 6 years old and you were dependent on a parent who wasn't dependable? And when I say not dependable, let's say the parent wasn't feeding you regularly, right? Or let's say the parent would yell at you, over nothing. Would yell at you because you made a mess with your food, which you didn't know any better. So you got
or criticized you all the time,
or criticized you, or made negative comparisons to you.
Right.
You're just like your father, or you're just like your mother. You're da 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 da. All negative stuff.
Name calling.
Right. Right. And so what does that do to you? Well, it doesn't make you feel good, right? What it does is it makes you feel scared, and it makes you feel badly, and especially if you're negative, if you're being treated as though your needs don't matter. We all have physical needs, and we all have emotional needs, right? And so what are the physical needs are pretty obvious, right? We need warmth, we need shelter, we need food, we need water. Those are the physical needs, and pretty straightforward. We got that or we didn't get that. But the emotional needs, even though they're straightforward, they're not as easily understood, especially if our parents were raised by people who also were wounded and they didn't understand what emotional needs get met.
Exactly. I mean, sometimes, we get a double whammy effect here, because the grandparents who themselves didn't know any better and they raise our parents, they are also in the picture. So not only we get those pervasive traumas from our parents, we may even get it from extended family members.
Exactly.
We may get it from the same community we live in. We may get it from the trusty places that we go to, right?
Mm-hmm.
So it's not just from home, but it does start from home. And then, how based on how we feel about ourselves, we allow kind of more trauma coming in, right?
And I'm so glad you brought that up, because what happens if we're traumatized, and I'm going to talk now about the emotional traumas.
Right.
What are our emotional needs as children? Well, first and foremost, we need to feel safe.
Right.
We need to feel safe physically, foremost, and we need to feel safe emotionally, meaning that we're treated with kindness. Kindness is grossly underrated. Treating people with kindness goes a long way towards creating connection and love within the person and between you and the other person. Unfortunately, our society recently has gotten away from that, and we haven't been treating other people with kindness.
Right.
And we see what happens: a lot of hatred, a lot of division, a lot of fear, and a lot of acting out of negative things which are harmful to other people, even going as so far as killing other people, right? But as children, we need to be treated with kindness, and that means that when we're treated with kindness, that means that we feel like we're understood, and we also feel like we're important. When somebody treats us not unkindly, we feel like we're not very important. When someone treats us kindly, we do feel like we're important, like we matter.
Right.
When we feel like we matter, we become free then to express ourselves and to say what our truth is. And we learn to express ourselves pretty quickly. The first year of life, we express ourselves in a lot of ways, although we don't know how to talk yet. We can still make sounds. We can still point to things. And we can still turn our bodies in certain ways that let our caregivers, our parents, know what it is that we're needing and what we're wanting. By the time we reach around age 2, we begin speech and we learn how to talk, and then we increase our ability to express ourselves and to say our truth. So what we're talking about now is being able is what we call freedom of speech or freedom of expression.
Right.
Our freedom of expression is so precious because without freedom of expression, we have to suppress our true selves. We have to suppress what we really believe, what we really think, what we really feel,
and what we really want.
And what we really want.
Right.
And when we suppress it, then, as we said earlier, it goes directly into the subconscious mind. And then, and then once it's in the subconscious mind, it becomes problematic because something triggers us, and then we don't know what to do with all those feelings that start erupting because we've been holding on to those feelings.
Exactly. Yes.
Yeah. So.
Is this the time, that fear is basically a preventive factor of our freedom, of feeling free?
Exactly.
Yeah.
Exactly. So fear is something that we are all born with. When we're born, we have a fear of falling, right? That's ubiquitous to the human species, and we also are born with a fear of loud noises. Those are two fears that are inborn. The other fears we have develop, right. And as we become aware in our intelligence, our brain starts being able to understand things. We recognize that things can hurt us.
Exactly.
Right.
Right. I think human beings experience their initial fear. I think is during birth. When the infant is becoming separated from the mother and it's been exposed to the air and the very first breathing. That separation, I think, is a trauma that by nature is provided, and that's one of the reasons that they immediately put the infant on the mom's chest.
Yeah.
So that the infant can hear the heartbeat.
Right.
So we do experience fear, and like you said, fear is a feeling that we are, that's within us, just like happiness, sadness, and anger, right? And the other feelings we learn about them, like the shame and the guilt and the sinfulness.
Yeah.
So those are the social feelings that we get, and we get that through the trauma. It becomes part of our PTSD.
Right. And so now they have ways of birthing children that where they recognize that that children can easily be traumatized at birth, and now they have places where there's soft music in the delivery room. The child is not smacked on the behind when they come out.
Right.
The child is invited out.
Right.
And the child and the lighting is very low, and the music is very soft and melodic, and then the doctor or the person who's birthing the child is welcoming the child and say, "Oh, welcome, welcome, welcome little boy or welcome little girl. I'm so glad you're here, and your mommy can't wait to see you." And then they take the baby and gently put the baby on the mother's stomach, and the mother nurtures.
Yeah, and that is such a beautiful thing, experience of watching birth. I have done that. I watched my cousin give birth, and I was the only one there with her, and it's such a profound experience, seeing that separation and the welcoming. I mean, a lot happens within that moment.
Mm-hmm.
A child is separated from mom. A person suddenly becomes a mom, and the child, you know, is just experiencing the first impact of the air, and then going back to mom, and the dad is there. I mean, it's just so beautiful, you know, beyond words.
Yes.
You know,
Yes, a miracle.
It's a miracle. It's really a miracle that,
Yes.
you know, and it's one of the most beautiful experiences in my life, watching that birth.
Mm-hmm.
You know,
Mm-hmm.
and then how, like you said, baby is welcomed, um, uh, and I wish that that would have happened in every birth.
Mm-hmm.
You know,
Mm-hmm.
and we know that's not happening in every birth.
No, of course not. But
Yeah.
we're here to educate, and we're here to talk to people about things that will impact them, and whatever we say, they can take with them, and they can utilize that in their life, and they can pass it on to other people. And that's what I love about doing this, is that hopefully we're impacting people in a positive way, and we may never get to meet, and probably won't get to meet the majority or maybe any of these people.
Any of these people, yes.
However, we know that the information that we're putting out is about how to be a happier and more joyous and more loving in our life, and how to pass that on to the people we care about.
Right. And even if we are facing a traumatic situation, which sometimes they are avoidable, right?
Mm-hmm.
It is through kindness, it's through, you know, love, it is through welcoming each other's experiences, and allowing a safe place for the individual to share, to talk.
Right.
We can, you know, participate in the healing process with
Mm-hmm.
them.
Mm-hmm.
We may not be able to heal them fully, you know, but at least we can give them a safe place for them to just be there.
Yes.
You know.
Yes.
So that's what individuals can do.
Yes, that's what we can do
before they get to a professional.
Exactly. Exactly. So, what is emotional safety? Emotional safety is the ability to know that the person wants the best for you and is willing to listen and try to understand what's really going on inside of you. It's emotional safety has to do with our inner world, and that's in direct contrast to where we come from as a species, where we had to worry about survival on a day-to-day basis, and therefore everything that was about behavior. So when you're a child, we now know that your behavior stems from your thoughts and your feelings, and that if you are understood and you are given the message that you matter, then your behavior will be different than if you're given that other message that you don't matter, or you're not good enough, or you'll never measure up, or what's the matter with you. The question, what is the matter with you, I think is probably one of the most harmful.
Yes.
In that it's a small t trauma.
It is, yes.
Because as soon as you ask a question of someone, what's wrong with you, their brain goes into search mode. And once it's in search mode, it's looking for the answer. And we know that if you ask a question and your brain goes into search and you're looking for an answer, you will come up with answers, but it doesn't mean that those answers are correct. It just means that you will come up with an answer that perhaps validates your question, right? So it's very, very important to treat your children as though they matter and as though their feelings matter. And so going back to trauma, what if we're born into a family where healthy needs are not met, and the child then feels not safe emotionally?
Well, let's find out about this after our commercial break.
We'll be back soon, and we will talk to you about this fascinating topic.
And we want to hear from you, 951-922-3532. Please join us.
Bye-bye.
Impacting our relationships. Dr. Robert Jaffe, you were talking about the important aspect of being born in an unhealthy family environment.
So, yeah, and so the problem is that, and again, I want to reiterate, this is not about blaming.
Right.
We're not here to blame our parents. A lot of you may be listening, are parents. I'm a parent.
I'm a parent.
You're a parent. I'm a parent. And so we're not here to blame, but we are here to speak truth and to understand.
Right.
And you know, as a parent, you know, I'm still a parent, but I was a parent of a young child many years ago. I wasn't who I am today. I was more limited. And when I look back on it, I can say, okay, there were mistakes that I made that I would do differently now. And of course, those mistakes impacted my children. Hopefully, as parents, we do more positive than negative. And hopefully our children are strong enough to be able to forge ahead, even in spite of not getting the best or a great upbringing.
Right. I mean, when I look at, you know, my parenthood at the beginning, when my daughter was born, and looking back at all those years, and she's 37 now, I ask myself, if I go back, would I change something? Of course.
Mm-hmm.
Of course, with the knowledge that I have today, with the experience that I have today, obviously I would do a few things differently.
Right.
You know.
Yeah, absolutely. Yeah. So this is not about bashing anyone. Now, that being said, it's very, very difficult for the majority of people to think of their parents as making mistakes or as doing something harmful to them. We call this idealization.
Right.
And the reason that we idealize our parents is because basically we have to. We have to when we're little. It's virtually impossible for a young child. When I say young, I'm talking anywhere from one to 10, really, especially 1 to 5. But for any child to think of their parent as not being capable or able to take care of them.
Exactly.
We may know it intellectually. For example, that there are parents who are alcoholics or drug addicts, and they leave us alone a lot, or they fall asleep a lot, and we recognize that we're on our own and we have to take care of ourselves. But that's an intellectual awareness. On an emotional level, we're still dependent on them. We still can't go out into the world and earn a living. We still can't write a check for the rent. We still are dependent upon them. So we look up to them. And we look up to them even in the face of their own faults. And what we have learned in psychology is that the more that we didn't get nurtured as children, the more we tend to idealize our parents. Because the greater the need to feel as though we were taken care of, because we didn't get taken care of. So we're left with that yearning, that wish that we were taken care of. And so oftentimes when people come into therapy and they're asked about their parents, they will say, in all honesty, I had a wonderful childhood.
Oh yeah, I have some of those clients.
Yeah. And of course, you know, but then if you say, okay, well, tell me about your wonderful childhood, and then you see that they're not able to talk about it very much, or they flat out say, I don't need to go there, I don't need to talk about it, there's no problem there. Then you know, there's an old expression, thou protesteth too much, right? Thou protesteth too much. What does that mean? It means, why aren't you willing to talk about it if it was so wonderful? And then people will rationalize and, well, that's not why I'm here.
Mhm.
See, and they will tell themselves and you, well, I don't want to go there, not realizing that there's probably a lot of pain there, and they're trying to avoid the pain. So the problem in psychology usually is about helping people to recognize that they didn't get what they needed, because we can't deal with something that we are in denial of. And the denial of anything being wrong with our parents, or with the way our parents treated us, or with the way we saw our parents treat each other,
Or
is,
with the way that the lifestyle was altogether.
or yeah,
Yeah.
yeah. And
Sometimes parents, they themselves are caught in situations that they even can't recognize that they are causing trauma,
right,
like alcoholism,
exactly.
like financial hardship,
Hmm.
right? And then what they have is expression of love for their children, and that's good. But the child goes through trauma just witnessing parents' alcoholism. The child goes through trauma because of financial hardship, right? The child goes through trauma for living in an unhealthy neighborhood, even though parents don't want to do that, don't want to, they do everything for the children to experience love, but sometimes the situation is out of their hand, is out of their power.
Yes, and I believe that that's absolutely true. And I also believe that parents can either add to it or ameliorate it,
Yes,
right?
right,
Depending upon how they respond
right,
to those traumatic things.
right,
What I'm talking about right now is when the parents themselves, through their own childhood wounding, pass that on to their
right,
children,
right.
and the child, because they've idealized their parent, they continue to do the self wounding and the wounding of those around them, without recognizing that they're passing it on.
Right.
Yeah. So what do you need to do in order to heal? The first and most significant thing to do is to recognize that you're in denial,
Oh yeah.
right?
And how do we do that, by the way? Because uh, I see that one of the challenges I have in therapy is to get the attention of people that they are in denial, and I know you're the master of that. I know that you know how to work with that very well.
Yeah, yeah. Well, so what I believe is that people are doing the best they can, because if they knew better, they would do better.
Right. I just want you to bring you in the picture more.
Oh,
You went back too far. Okay.
okay. so so the way that I look at somebody who's in denial is that they must have been traumatized,
Mhm.
and that their denial serves them in terms of their coping mechanisms.
Right.
So some therapists look at it as resistance.
Mhm.
And then if you look at it as resistance, then you're trying to break through the resistance. And I think that that's damaging to the relationship between the therapist.
Exactly.
Yeah,
Yes.
it's damaging to that relationship.
Right.
And it's also not good for the person, because you don't know what that denial is keeping underneath it. It may be some very, very deep traumas that, if they did all of a sudden recognize it, that they might be unable to cope.
Right. Yeah, I see that definitely as a coping mechanism versus resistance. And when we insist on resistance, we're telling the client that we're giving them guilt, as a matter of fact,
Hmm.
which is more traumatizing versus healing.
Right, right,
Right.
right. So, there's an expression, by the mile, life's a trial. By the inch, life's a cinch, right?
Mhm.
So what has to happen then, if somebody is in denial, is we have to slow down and recognize that there's got to be good reason for it, and that we need to slowly, slowly chip away at the denial, recognizing that when the person is becoming defensive, that we're right at that place where we can make progress, or we can detract from progress. So when the person is beginning to have feelings come up and the emotions start coming up, we have to be very aware that those need to come up in the person's own time, in the person's own way, and not allow the person to go too far too quickly, and at the same time not encourage the person to shut down.
Right, and that's a very artistic part of therapy,
Yes.
right? There are also clients that they are very impatient, they don't see their denial and they want progress. And if they don't see progress or they don't feel they are making progress, they walk away from therapy.
That's correct. That's correct. And so to me, the doctor's code, and you and I are doctors, it is always at least do no harm.
Right.
Right. And so I would rather have somebody say, this isn't working for me and leave therapy than try to push them faster than is healthy for them.
Exactly.
Yeah.
Yes.
And so there's no easy answer to somebody who's impatient, except to say that I think that there's a lot here, and I think it is going to take some time if you want to. And if you don't want to work on it, that's okay, because I don't think I'm going anywhere. And if you don't like the way I'm doing it, there's a thousand other people out there that might be able to help you.
Exactly. And therapy is not a fast forward process, especially when it comes to denial, when it comes to trauma, when it comes to PTSD, and as a matter of fact, to any aspect of life situation that makes a person unhappy.
Yeah,
right.
There are some things that are quicker than others,
Right.
but in terms of PTSD, usually it does take some time.
It does take some time. So we are at the end of our program. We thank you for joining us, and thank you, Dr. Robert Jaffe.
My pleasure.
And then I'm inviting you also, we both are inviting you to please join us next week, Thursday at 3 p.m. for a first program episode on human sexuality, and also the second hour where we talk about trauma, addictions, codependency impacting relationship. And until then, don't forget, all you need is love.
All you need is love.
And we like to hear from you. Please call us, email us. We look forward to that.
And
see
we'll
you next week.
See you next week. Bye-bye.
Bye-bye.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed